animals get health assessment done on a regular basis. What will the wild animals do? Dr. Arun says even the wildlife's health can be assessed. When asked how, he was gracious enough to explain.
When there are advanced diagnostic tools and different varieties of lab tests, starting from your simple blood test to a serological test available in the field, but I strongly believe that there are very much field-oriented and easy to assess health examination protocols or even health assessment procedures are available, or we can definitely create something like this, and which is very much in practice in wildlife veterinary health assessment. One of the major part is the body condition score. In this image you can see that the thin to skinny, ideal, overweight and obese, there are 5 different body score conditions are established based on the available references of different species already by the city. We have came up with a new model for wildlife, especially for sloth bears, and ideal condition of the body score condition of the sloth bear is definitely appreciable, and also it makes the animal more healthier and then extend their lifespan or lifestyle or the quality of the life good in captivity. Similarly, there are fecal score conditions or scales are available, and those are very easy to understand and observe, and any wildlife veterinarian can definitely follow such kind of guidelines so that with your target species you can come up with these major 2 points of body score conditioning and fecal score conditioning, apart from their behavioral observations or even time budget studies will definitely give you natural or normal behavior of the animal, and it ensures the welfare and quality of life or even end of care life is definitely appropriate in any captive facility.
Another important area for a wildlife veterinarian to understand the captive animal health status is to categorize their fecal score. So I always feel for any species, if we can standardize some of their normal gut movement and also their feeding pattern accordingly, whether it is a seasonal or even a food ingredient based or even the age or their health status, always have some kind of changes in their fecal output. So the defecated material has to be closely observed, and then even some photographic evidences on a day-to-day basis will always help a veterinarian to focus on the fecal consistency, color and various components, including the worms and even sometimes undigested food or blood particles or occult blood or any other foreign materials in the fecal material. So this of course can be done or can be established in every species of our interest, but here in the slide I have given you whatever the research work we have undergone and then observed and documented in rescued sloth bears with their fecal matter observed during a course of several months to years. And in the first figure you can see the grass appearance of the feces of a bear or multiple bears diagnosed with verminous enteritis. As we all know that enteritis will always have differences in the color or consistency or the composition or even the amount, the solid matters or particles or anything in the feces will vary even by grass appearance. So you can see even the verminous enteritis will have these multiple levels of the difference of their fecal appearance will always give a veterinarian a good clue, and then accordingly we can suspect for any kind of infection either through a grass examination and also a microscopic examination or any kind of swabs for antibiotic sensitivity test and culture will always give us a better clue to ensure the individual or even the group of the animals are very well maintained under healthy environment. And in figure 2 we can see the gross appearance of the feces when they were suffering because of some kind of hepatic disorders. As we already discussed about, a lot of hepatic carcinomas in sloth bears leads to multiple areas of symptoms like through blood, like liver function test, and also their mucous membrane color, and the ultrasound examination or even X-rays will also give us some clue. But before going for any of those little invasive or even procedure needs an immobilization of an animal, it is always better to have a non-invasive ways of approaching the animal and identify the information or even the problem or illness well in advance, so that it will be easier for the vet to deal with the problem. And in the second slide you can see some gross appearance of the feces which were diagnosed with simple diarrhea. So that can also be easily differentiated from some kind of serious illness or any kind of hepatic or even any other obstructions or foreign body or even the microbiota disturbances like dysbiosis. So it's very important to understand a simple diarrhea from any other complicated problems. And you can see in the other figure 4, gross appearance of the feces for apparently healthy animal, of course, which is always be dependent on the kind of food what we are feeding. So that has to be always matched. That's why before we get into these kind of fecal score method or conclusion, we have to observe the bear for multiple seasons and varieties of food, and sometimes the undigested plant material or even seeds or any other material can also be expected, and which is not an abnormal stuff. So we need to first standardize and make sure the data is collected for a period of time before we conclude the fecal scoring method. And in the figure 5 you can always see the compulsive eating disorders, because sometimes we encountered some of these animals will be like eating mud and then eating a lot of other materials which are non-food items in their enclosure, sometimes because of their playful nature or even while exploring the termites or any other ants or any other bugs from the earth. Then they always take a lot of mud materials, and sometimes even because of pica kind of phosphorus deficiency, they always go and then eat mud or the feces from its own or other animals. So it is very important to understand the fecal scoring, and then if we can establish this fecal scoring for every animals of our importance or the targets, then it will be easier for the wildlife veterinarian to understand the health status.
Safety of each and every personnel involved in wildlife conflict mitigation situation, whether it is a wildlife veterinarian or the trained personnel who is dealing with the wildlife conflict whenever there is an agitated moment, or even sometimes even in captivity we feel sometimes accidentally the animal comes out of an enclosure, or sometimes breaks the barriers and then comes out of the their containing space, or even a retiring place, or even a feeding and retiring dens. So it is always important to keep a handy full body armor or full body protector set, so that in the field if you are going for any rescue operations, it will be always convenient, and the safety is first and foremost area that one should always keep it in mind, whether it is a assistant or even a wildlife veterinarian who is handling some of those physical restraining method or even chemical immobilization method. It is always important to have a full body protector or full body armor, so that the head to toe will be completely covered, and these are all really a strong material. And in our leopard rehabilitation center we always use this whenever our team is going for any such kind of operations, and it's protect starting from the head to toe. In every medical procedure we generally keep a checklist of all the operation theatre procedures for wellness examination or general health examination. As you can see, this long list always keeping us updated and also handy so that when the animal is on the table, we can definitely make sure all these examinations are done and make use of the animal when it is under anesthesia, and collect as much as possible samples or data so that it will be definitely useful for conserving the species in the wild. We discussed about a lot of advanced diagnostic equipments when it comes to captive wild animal health and disease management. So when the animal is on the table, we always prefer to utilize the entire animal for different aspects of diagnosis. As we all know that a simple auscultation by using a stethoscope to our thermometer to check the body temperature makes life much easier, and we can definitely understand the current condition of the animal when they are on the table. And there is always another small field tools, whether it is on the table in the clinical setup or even in the field. We can always use this pulse oximeter, which gives you oxygen saturation of the blood and pulse, heart rate and respiratory rate. So this SpO2 monitor or the field monitor for blood gas, the field equipment used for collecting pulse oximeter reading is definitely a good tool for any wildlife veterinarian, whether it is in a captive facility or in the free ranging area. And next comes to the ECG. ECG is another handy tool, and nowadays there are a lot of portable ECG machines available. As long as we are knowing where to connect the leads, we can definitely take ECG parameters. With the only challenge is, with the anesthetized animal, it is always challenging to find the normal value of the heart electric conductions. So that is the reason that it is not much familiar in captive condition when the animal are under anesthesia, but it is still a valuable tool to identify any heart issues. And then parallelly, that will be associated with the blood pressure monitoring. So there are pulse Dopplers available, but in the field it is easier and it is very economical tool to get the blood pressure of an animal like in human beings. And the other handy tool is blood glucose parameter. So the blood glucometer is another easy tool that you can easily take a drop of blood from extremities or even the ear tip and then collect the glucose value even when the animal is just constrained in the squeeze cage or a crush cage, and it is easy to take one drop of blood and understand that. And as we all know that we usually take blood samples from the animal through venipuncture, and that will give you a lot of parameters with respect to the hematology and vital organ functionalities like biochemistry values and electrolytes. And coming to other field equipment, this is again this is Woods lamp, which is very much useful when you want to differentiate any fungal infection from a normal skin infection, so that this will definitely give you a clear picture about the fungal infection of the animal, and you can deal with the treatment accordingly. And few other tools, as we all know that the field weighing balance, this is again makes a lot of use when we are actually taking the body weight in the field. And when it comes to little advanced diagnostics, this is an dental X-ray machine which comes in handy, and then it's a battery operated equipment. When the wildlife is concerned with respect to the diagnostic equipments or even tools, which should always be a battery operated one, so that it is very convenient in the field. And we have even a big X-ray machine which takes up almost 40 to 60 MA X-rays in the field, and with a computerized radiography or digital radiography, we can do the X-ray or radiography in the field itself. And coming to another good diagnostic equipment is an ultrasonography, which has got multiple probes which can even deal with the abdomen as well as the cardiac ultrasonography, so that we can definitely ensure that the abdominal organs and the heart's functionalities are checked. And in fact, we developed a small procedure by using ultrasonography to check even the chest ultrasonography, so that it can give the lung quality, though it is not much in practice, but in wildlife, with the prevalence of tuberculosis in the sloth bear rehabilitation program, we definitely put use of all these equipments to a maximum extent and wanted to use the ultrasonography for even examination of pulmonary tuberculosis. We do a lot of dental procedures like root canal treatment and extractions with various animals, starting from sloth bears to leopard and tiger, and also for few lions we have conducted as a team. And then this digital dental X-ray with a digital probe, you will immediately get the X-ray images like this, and then when we are going for any extraction or even root canal treatment, we need to ensure that during the entire procedure we have to make sure the filling is proper, and then we have to ensure that there is no air bubbles inside. So throughout the procedure we may have to take the X-rays in multiple times to ensure that the filling is proper, and so that the animal will not have any post-operative complications. So these are all the tools, though it is looking very fancy, but still it is affordable, and it is important for us to utilize such kind of tools in order to achieve a better welfare and quality of life in captivity. And the other important mission, when the animal is on the table, the patient monitoring system is one of the beautiful equipment, and it gives you all the pulse oximeter reading, which is like the oxygen saturation of the blood, and this digital probe inserted into the rectum of the animal gives a constant monitoring of the body temperature, and in addition to pulse and heart rate and respiratory rate. And this machine has also got NIBP, non-invasive blood pressure check. So these equipments are really handy, and it is economical, and when the animal is on the table we will have a continuous monitoring of the animal, so that the anesthetic and the anesthetic procedure and the entire operative procedure, the animal will be under proper monitoring, so that the data which we are deriving out of this kind of equipments will give you a lot of good scientific publications, and to ensure the animal is safe and the handler and the wildlife veterinarian is also safe when we are looking and when we are using all such kind of tools for the betterment of captive wild animal health and management. One more field tool for efficient diagnosis is a thermal camera, which is put in use in several wild animal conflict situations, or even if you want to track any animals or to reach the animal which are in the thick forest. It is easy to understand, and also it is used in captive facilities when the inflammatory conditions of the animal can be easily understandable through this images, and these are one of the good tool, though it is little on an expensive side, but it's a durable equipment or a tool that you can definitely use it for practical purposes. This is our dental machine IM3, and this is useful for both root canal treatment and extraction procedure. And this is the piezo ultrasonic scaler, which is also attached with the dental machine. We can do scaler by using this tool. And this is a gas anesthetic machine, which is always safer by using isoflurane, and there are advanced machines with ventilators available, and even the next generation of inhalant anesthesia also the veterinary fraternity has now imbibed, and that is sevoflurane. But isoflurane is very much used within the zoo community, and it is always safer for wide range of animals. And this one is a therapeutic ultrasound, so we use even laser and therapeutic ultrasound for alleviating pain, and whenever there is any musculoskeletal issues and injuries, sprains, and it always gives very good painkiller action, and it gives a lot of soothing and comfort to the animal, and it is always easier to use, and it is a non-invasive method of giving pain relief to the animal. We do have some of the portable and field therapeutic equipments or tools which are all really a good toy to use in captive facilities. One is therapeutic laser, and this is class 4 laser machine which is very good for photobiomodulation therapy with respect to any kind of spinal injuries or spinal problems, and it has got a lot of species selection criterias, and then depends on the problem you can always have the module selected and you can use it appropriately. And the only important thing is we have to wear protective goggles before you using it, and also ensure that not to use it for cancers and also for eyes, because the class 4 laser is not good for the eyes and for cancer tissue. And this machine has got a lot of benefit, and the entire machine is user friendly, and this is again a battery operated machine which can be used in the field, and all kind of musculoskeletal and then fracture, gum issues, dental issues, and even fracture. There are multiple indications to utilize this machine, and it gives very good result and improves the welfare of the animal. When it comes to geriatric patients or geriatric care, this is one of the best machine. I always feel like utilizing it for each and every problem except the one which is contraindicated to use laser machine for. Whenever we are planning for any wet lab practices, so it is always important to have some basic equipments, like you have to have autoclave because we will be doing a lot of procedural with sterile environment. If not the environment is sterile, then we have to have equipments and tools, surgical tools to be autoclaved, and then use it even for minor procedures. And the centrifuge is another handy equipment which is important. Whenever we do minor blood work, we can always use it here, and it does not require much time or even resources. So it is easy to even spin the blood and carry out all the basic hematology and biochemistry parameters. And we do have a electrolyte and blood gas analyzer, and which is again a handy and also battery operated machine. A drop of arterial blood can immediately give the gas saturation, blood gas saturation, and the electrolyte when the animal is on the table with immobilization. It is easier to check the status of anesthetic agents, and also to validate the blood gas parameters are optimal. It depends on different anesthetic reagents. And this is again a handy tool which is urinalyzer, and there are a lot of strips available nowadays. Just by dipping it into a urine sample, I mean freshly or hygienically collected or sterile urine sample, and we can use the Uristick or any stick for assessing multiple parameters, and those sticks either can be directly assessed or interpreted by using a color code, or we can just use this urinalyzer, and then if you put the strip inside, and the machine will give you the readings as interpretation. So it is very easy to utilize this machine, and these are very common tools which is very much used for diagnostics. And a simple or a compound microscope, you can see the regular fecal analysis or even copra analogy of all bears on a daily basis can be easily done, and we can even document the images by storing such kind of images through the compound or trinocular microscope, which gives a lot of confidence to an upcoming vets. And also you can do good publications as well as to create record and pass on to the next generation will always be useful. And these equipments are really handy, and it is useful for any captive animal health and disease management. There are varieties of biochemical parameter analyzers are available, especially in wildlife. We rely on multiple biochemical or even hematological analyzers, and biochemical analyzer will give all the vital parameters like organ vital parameters like your liver function test and kidney function test and all the electrolytes. Everything will be done, even starting from your lipase, amylase, all those parameters are possible to evaluate through this machine. And the hematology machine is a normal complete blood count machine. But when it comes to birds and reptiles, then we have to go for a specific machine because RBCs of birds and reptiles are nucleated, so we can't use a regular machine. But these are very basic equipments which we rely on for any kind of diagnosis in case of wildlife veterinary health and management.